Hi everyone, welcome to the lymphatic system. So today we're looking at learning outcome 10, understanding the structure and function of the lymphatic system, which forms part of the A&P module for the level 3 Diploma in Sports Massage Therapy. As always, we're going to start off with functions of this system. So this is going to give you a little clue as to my 4-letter acronym for this system. So RAFT, R, A, F and T. Now R is the similar function to all of my acronyms. So wherever I have an acronym with an R in it, it normally stands for this word, which is removal. So the lymphatic system helps to remove excess fluid. Now where does this fluid come from? So fluid is found all over the body. And the fact that we are 70% water is quite incredible, thinking that we are pretty solid people. But the water will come from in the cells, so the cytoplasm, around the cells, the tissue fluid. Can come from the blood itself, the plasma. And any process that happens in the body, there'll be some leakage of fluid or dispersal of fluid between these different structures. So the lymphatic system can help remove this excess fluid, up to 3 litres a day. A for antibody production. So thinking of the lymphatic system as being the immune system, antibodies are there to help build up the body's resistance to diseases and certain disorders and viruses and things. So antibody production and also lymphocyte production. So I'm hoping you've recognised lymphocytes as being something we talked about in the cardiovascular system. When you think of the 4 components of blood, we think of plasma, red blood cells, platelets and white blood cells. And what's the technical name for a white blood cell, or medical name? So a white blood cell is a leukocyte. And if you've looked at my slide on the cardiovascular system, there was a picture of 5 different types of white blood cells. So again, none of these systems work completely on their own. They're all kind of intertwined in some way. So when I teach, I like to keep talking about the other systems that we should have already covered or maybe covering in the future. So the 5 different types of white blood cells we mentioned, I remember it as 3 fills and 2 sites. So they're the names of the blood cells. So we have a neutrophil, a basophil, and an eosinophil. They're the 3 fills, and a monocyte and a lymphocyte. Okay, so that's where we are now. We're on lymphocytes. F for filtering, so filtering waste. I think of the lymphatic system as being the second circulatory system of the body, where the first one is cardiovascular. So think about how the blood moves around the body and in the pathway. If we follow one blood cell around the body, how it can pass through the heart twice. This is an add-on to that system. So it really closely links to the cardiovascular, but it doesn't actually start and finish where it starts. The lymphatic system will start at the extremities. It might start at the fingers and then work its way up to the heart in this pathway, whereas the cardiovascular system will just keep circulating round and round. The final function of this system is transporting, so transporting fat and dietary lipids. Again, we don't study digestion as part of this course. You might be studying it elsewhere. But in digestion, when you look at the intestines, there's tiny little things called microvilli, or villi, and then microvilli. So these villi are extensions of the intestines. They increase the surface area. And with each one of these little projections, you've got a central tube called a lacteal. And the lacteal is part of the lymphatic system, so that can help to absorb and also break down and then transport the fat around this system. So structures of the lymphatic system. are similar, but there are some differences to cardiovascular. If I asked you what the 5 main blood vessels were in the cardiovascular system, I'm hoping you would tell me, let's count again, arteries, arterioles, capillaries, venules, and veins. So they're the 5 main structures. Even though there's lots of different forms of veins and names of arteries, they're the main types. In this system, this tube is showing, or this diagram here is showing there is an end to this tube. So you never get an end to a blood vessel, because that blood vessel goes from a larger one to a smaller, and then back to the heart again. So this is a lymphatic capillary, and a lymphatic capillary is only 1 cell thick, and you can see it there. You can see the excess fluid entering the capillary, and then by use of a valve, it's going to head off in a direction, in one direction only. Lymph vessel. So we talk about blood vessels, but when we talk about blood vessels, we talk about lots of different types, as I've just mentioned. So veins and arteries, capillaries, venules. A lymphatic vessel, though, there's only one sort, and it just carries, it's a compilation of lots of different capillaries that have united, so it's a larger vessel where the lymph can travel through. It only goes in one direction, so you can see this fluid passing this way. If the fluid went this way, if the fluid went into that area, where would it go? It may drain out here, but it would also enlarge this area. So the fluid has to follow this pathway. Lymph node is another part of the lymphatic system, and a node, another name for a node is a gland. So these nodes or glands of the body, especially when you feel a bit run down, then you know they're working. Because you might feel that certain parts, it might be here, might be under your jaw, there's some underneath the armpit here. And as you start to feel a bit ill, you might find those areas are tender because they're swelling up and they're producing lymphocytes. So lymph nodes or lymph glands are areas of the body normally found at joints that will then produce lymphocytes when they're needed. A lymph duct. A duct is a larger vessel. So as this system eventually starts at a capillary, then to a vessel, goes through a series of ducts, before it eventually goes back into the cardiovascular system, it drains through a large lymph duct. Okay, so that's the largest structure found in this system. Then you have the fluid. So in the cardiovascular system, the fluid's called blood. In the lymphatic system, it's called lymph. Okay, and it's as well as being mainly water, I think it's 98% water, it will also carry monocytes and lymphocytes. And then you have the primary lymph organs and the secondary lymph organs. So we'll look at that on the next page. But these are parts of the body that are responsible for this immune function and also producing lymphocytes. Okay, so the lymph organs. The primary lymph organs are where lymphocytes are formed and matured. The picture up here, if you can recognise that picture from any other systems we've looked at before, is a bone. And this part here, you can see, is the red bone marrow. And that's found in the epiphyses of a long bone. So red bone marrow is where blood cells are produced, of which lymphocytes are one. And the thymus gland, so I haven't got a picture of a thymus gland, but the thymus gland is found behind your sternum. It's not thyroid, thyroid's up here. Thymus is behind your breastbone or your sternum. And the thymus gland is really active in childhood and going through adolescence, but after puberty it tends to shrink and becomes inactive. So in children, the thymus gland is good at responding to viruses and building up immunity via the T cells. But once you get past that stage of life, it doesn't work, and it shrivels down to about the size of your thumb. So building up immunity as a child is important, and my beliefs are that children should experience life and be able to go out and do what children should do, rather than being kept in a very sterile environment where their body doesn't have a chance to build up immunity, which they're going to need for their life, for the rest of their life. Okay, and then we have secondary organs where these extracellular fluids are filtered. You may recognise this, especially if you've had those chopped out yourself. Okay, that's not the first one on my list. First one is lymph nodes, which we're going to go through because there's different sites all over the body that contain these lymph nodes or lymph glands. But the next picture is showing the tonsils. Now they look quite enlarged, depending on how good you are at putting your tongue down and looking down the back of your throat. You may just be able to see at the back your tonsils. And being of my generation, so I had a lot of childhood friends that had their tonsils out. They'd have a sore throat a few times and go and have their tonsils removed. But now they don't do that often. I think you have to have it, is it between 7 and 9 times in a year before they even think about removing them. So they're tonsils. Again, when you're feeling a bit run down, feeling ill, or got a bit of a virus or a cold, then they'll start to swell up. But they swell up because they're producing more lymphocytes to try and help fight infection. Then you've got the spleen, and the spleen is an organ found in the upper left-hand quadrant here, just underneath the rib cage. And it's an organ that will dilate to hold any excess blood and constrict to push blood back into the system. It also helps to break down old blood cells. Appendix. This is showing the appendix here. So the appendix is around the size of your little finger. And if you've had your appendix out, you'll have a scar on the right side of your body. So it'll be quite a small scar, and then removing this appendix. Now, appendix in modern life is, again, hasn't got any functions, but back if you believe in evolution, back in the day we were more primal and had a slightly different diet. It was to help digest more foliage, and things were a bit harder to digest. Whereas in our modern lifestyle, it's pretty easy to break things down. But the appendix, we know about it when it causes problems. It can become inflamed. So you have appendicitis and then an appendectomy to remove it. And then the final secondary organ is a Peyer's patch or Peyer's patches, which are found in the intestines. Okay, so these are where the extracellular fluids are filtered. So what is lymph actually made of? So it's very similar to blood plasma, and blood plasma is 96% water and contain hormones and nutrients. So it looks similar in colour. So water is the main ingredient. Lymph will contain lymphocytes, the cells found in the system. It contains some good things as well. There's some plasma proteins in there, and we've said the 4 functions of the lymphatic system. What was the final function? What was T's? T was for transporting fat, wasn't it? So there's some lipids found in lymph, and there'll be waste because it's to do with getting rid of waste. And then my final bullet point on this slide says no erythrocytes, no red blood cells. I mean, I could list a billion things that it doesn't contain, but in terms of exam questions, sometimes they like to put in that erythrocytes are part of the lymphatic system. So if you see that in an exam question, you know that's the incorrect answer. Okay, there's definitely no red blood cells found in lymph. And if you think of lymph as being a straw-coloured fluid, then that shows what's inside it, as in no red blood cells. So if you have an A&P revision pack with me on the course, then you can take that out and we'll label up your lymph node or your lymph gland. So we're starting off with the afferent vessels. Afferent. So underneath there, you can see I've written, you can see that. A now is arriving, the arriving vessels, And E for efferent vessels, E is the excitin vessel. So all the afferent vessels are taking all this fluid it's got from different parts of the body, and it's collating it all into this one lymph node or lymph gland. And you can see inside here quite a complex structure, but that's where the filtration happens. That's where it's filtering the waste and also producing the lymphocytes. Then we've got the blood vessels, so red and blue represent the capillary network around this lymph node. And then the efferent vessel is excitin. So you get lots of afferent entering or arriving, okay, and then it comes out through one efferent vessel, which is then going to take it on further on its journey closer to the heart. Then we've got follicles. The follicles are found within the lymph node, and this word here some of you will recognise, trabeculae. Trabeculae was a word we used when we looked at the skeletal system, and I said trabeculae was more of a formation, a structure. So if you can see, it's pointing to these purple lines. Okay, there's lots of those purple lines dividing structures within the lymph node. So this trabeculae is more of a structure. We said there was a type of bone tissue that was also called trabecular bone, and that was spongy bone, wasn't it, or cancellous bone. And then around the outside there you've got the cortex. So the cortex is the wrapping. Cortex means outer, and the word medulla means inner. So you have a cortex and a medulla to lots of different structures of the body. Okay, so what do lymph nodes do? So firstly, they help filter foreign substances, okay, things that shouldn't be in the body, and they also destroy. So they filter and destroy, and they can destroy, for example, when we looked at monocytes, we said they engulf and digest undigested bacteria. So that's how they can destroy certain substances. And they have an immune function. You can see the tonsils there enlarging when they become inflamed and activated. So if you've got this diagram here, we're going to just label this one up now. I like this diagram because it shows both systems. It shows the primary circulatory system, it shows the cardiovascular system, and then in green it shows the lymphatic system and how they work closely together. So it's a bit of a revision actually. Let me get my pen. I've got to try and, I'll be doing this backwards now, so I get it wrong. So this is the left side of the heart, left side is the red side, and it's pumping out through this big structure. That big artery is called the aorta, and the aorta is full of oxygenated blood as it travels through its journey through the body to get to a capillary network. So these would be arterioles maybe, and these tiny ones are the capillaries. And then as they unite again, they're forming venules and then veins that take the deoxygenated blood back to the heart. That would be the inferior vena cava, and that would be the superior vena cava, back to the right side. Now the right side is now deoxygenated, and it's going to be pumping blood through those semilunar valves here, and this would be the lungs. So what circulation do we call the lung circulation of blood? We call it the pulmonary circulation. So it's going to the lungs, picks up oxygen and returns back to the heart, ready to be pumped again. And you can see there, that circulation, you will never get to an end. There is never an end point. But if we add in this lymphatic system now, we've got an end point here, we've got an end point here. When I say end point, I should really say start point. So this start point is where the lymphatic capillaries pick up any excess fluid. So where there's diffusion, so where the oxygen will come out into the cells of the body, and carbon dioxide will then enter, there'll be some leakage of fluid. So this now becomes tissue fluid. And if there's too much, the lymphatic system will pick up that tissue fluid, pick up the excess fluid, and carry it this way on its journey. So they only work in one direction. So we've got lymphatic capillaries, are these tiny little ones here. And then as they unite and become slightly bigger, they become lymph vessels. Remember, there's no vein or artery in the system. So these are getting slightly bigger and bigger, and it takes the fluid and its waste products through a selection of different glands or nodes. So here we have a lymph node. It can pass through a series of those. My diagram just shows one, but then as it comes back this way, it then becomes a larger vessel before it enters what's called the subclavian vein near the heart. So this extra fluid now, which is now being cleaned, will join the circulation again. And now it's part of the cardiovascular system, which is then going to keep going. And then at any point in this journey, there'll be leakage of fluid, and there'll be bacteria, and there'll be microbes, and it's picked up and cleaned, clean, and pumped back as a cleaning system. Okay, also on here, just to show, we've got the lymph duct and the pulmonary. This is the pulmonary circulation, whereas this is the systemic to the rest of the body. So it's quite a nice diagram. If you want to add that onto the one you may have practiced when you did cardiovascular system, I ask you to try and draw something similar to this. Okay, and if you add this in here, that can help you to understand the two. Okay, I've got a video here. I'm hoping, if you just excuse me, I'll get up and play it. I'm hoping this will work. Okay, so this is the capillary network. Blood vessels or blood capillaries, and then that could be leakage of fluid. And the leakage of fluid is picked up by the purple structure, which is the lymphatic capillary. So all this, there's a blind-ended tube here. So all this extra fluid and waste is picked up by the capillaries and travels on its journey into blood, lymph vessels and into these lymph nodes and glands. So these are the arriving vessels, the afferent vessels. And then as it goes inside this lymph node, it's filtered and cleaned and passes out through the efferent vessel. As it works its way back through these slightly larger structures, that would be a lymph duct at the top here, before it returns to the cardiovascular system. So really short video, but quite nice to see it as something that is a bit more interactive. Okay, so I'll just come back.
All right, so we begin our discussion here.
No, we won't. Excuse me. I'm not very good at editing, you see, so I can't even take that out of mine, but we're back where we need to be, so okay. We're nearly done, actually. Got 2 more slides just on the structures found in the system. So again, if you've got your books, you can label them up. We're starting with the lymph nodes found up here near the neck, and the word meaning neck. There's a couple of them in the body. Is a term called cervical or cervical. So it refers to the cervical vertebra, but the word cervix also refers to neck or neck of the womb. So we have the cervical lymph nodes. And then we're moving down to the front of the elbow here. So they're all, as you can see, they're all found in joints because this system struggles with movement. There isn't a central lymph heart pumping it around. It moves via movement of the body through muscles and therefore can help pump at the joints. So this one here is the supratrochlear lymph node, and the term for the front of the elbow is cubital. So it's often called cubital. I think the exam paper will use the word supratrochlear. The next one down on here is pointing to the stomach area. So these are the abdominal lymph nodes. And then moving around here, this would be pointing to the back of the knee. Again, where the crease is, so a sensitive part of the body, which is also a joint, is a word called popliteal. And the word popliteal refers to, or the word poplar, is a popliteal artery, popliteal lymph node, popliteus muscle, popliteal nerve, Okay, anything to do with poplar refers to the back of the knee. And then at the top of the leg here, so where the natural fold is between the thigh and the stomach, because the natural fold at the top of the leg is the inguinal lymph nodes. Okay, inguinal, and this is again quite tender. Inguinal hernia is where this area pops through, and it's been quite painful. So that inguinal is the top of the thigh. And then we have the iliac lymph nodes found around the iliac crest or top of the hip. And then finally, up here, I mentioned this one earlier, the armpit lymph node, and the word armpit is axilla. So this is the axillary lymph nodes. Okay, so I would learn the positions of these different lymph nodes, as in popliteal's back of the knee, axillary is armpit, just learn it like that. And then finally, we're looking at the lymph nodes of the face and the head. So we're going to start at the back of the head here. Okay, and the back of the head, that bone at the back of the head there is called the occipital bone. So we have occipital lymph nodes. And then moving down one from that, see this muscle here. As that muscle ends on that part, that muscle is the sternocleidomastoid. So that bony part just behind my ear is the mastoid process, and that's the mastoid lymph node. You may also see it referred to as retro-auricular. Retro means behind, as in retract means to go backwards, and auricular means ear, so behind the ear, but mastoid is the more common term. And then there's some lymph nodes just found here, and if you can see the purple, the nodes, but you can see that big gland there is the parotid salivary gland. That's the one that when you eat something like a lime or lemon, it kicks off a little bit. You can feel it. But on top of that, you've got your parotid lymph nodes. And then we have some cervical ones. We mentioned those on the last slide. The ones nearer the surface are the superficial, and then ones deeper down in the neck are the deep cervical, which leaves us with two more. So underneath this bone, here's the mandible, and it's a term that means underneath. So submandibular, underneath the jawbone. And finally this one here, right in the cheek. If you've done any facial anatomy before, there's a muscle underneath there called the buccinator, and this node is called the buccal, or some people say buccal lymph node. Okay, so buccal refers to the cheek. When I'm feeling a bit run down, this one often starts to swell up a bit, so much so that if I look up it feels like it's just stretching, it's quite sore. And then normally a day after that I get a cold sore. So it's my body preparing me for whatever I'm feeling, however run down I'm feeling. Okay, so they're the different lymph nodes of the head and the face. So in terms of, for the exam questions, I'll definitely learn where these lymph nodes are. I would learn the 4 functions of the lymphatic system and the different structures. Okay, so it's quite a short system. We've done it in 30 minutes. But I'm hoping now they're all starting to piece together. And as you start to revise for your exam, you can go from one system